Welcome friends, I am Dr. V.K. Chauhan, homeopathic physician. Revise with me homeopathic remedy Caladium sanguinum. This is part 7, clinical correlation. The text is taken up from Ellen's keynote and this study is good for BHMS students. Let us go to the PQR1, very sensitive to noise, slightest noise startles from sleep. Similar remedy is Asaram, Nux and Tarantula. Let us recap. The acoustic startle reflex is caused by an auditory stimulus greater than 80 decibel. The sound intensities are following. Dog bark is 80 plus decibel, glass shattering is 91 decibel, door slam 83 decibel, cough 79 decibel, sneeze is 82 decibel. For anxious people, a higher startle response tends to be part of their personality profile. Limbic system plays a role in it. Limbic system is a emotional brain and the amygdala is known to have the role in the fight or flight response. This is the seat of emotions. If there is a anxiety which feels that there is a threat to self or physical injury, the amygdala will make the person to fight it out or run away from fearful situation. And same thing you will find hippocampus also functions to form memories of the stimulus and the emotions associated with this. So all these structures of our limbic system, let us see where the limbic system is present. It is in the forebrain, inside the cerebral hemispheres. The part of limbic system is thalamus, cingulate gyrus, fornix, amygdala, hippocampus and parahippocampal gyri are present over there. Individuals with childhood abuse and trauma have generalized anxiety disorder, PTSD and depressive symptoms, shown a greater acoustic startle response. The Caladium subject is a well-known nervous anxious personality, maybe having the past traumatic stress disorder also. The PQR2 tells us about eructations frequent of very little wind, as if stomach were full of dry food. Recap, most belching is caused by swallowing excess air when people eat or drink fast and when they smoke. This air most often never reaches the stomach but accumulates in the esophagus. Some people swallow air in a nervous habit. Even when they are not eating or drinking, they keep on swallowing their saliva. Most of the Indians are in habit of eating, chewing pan, tobacco and betel nut. So while doing that, they keep on swallowing the air. Clinically speaking, belching is a physiological venting of excessive gastric air. When it becomes paroxysmal and has no physiological basis, it is one of the clinical manifestations of conversion disorder. The conversion disorder, we call it psychogenic belching or eructatio nervosa. This type of conversion disorder is dominated by visceral symptoms of persistent belching to get rid of the stressful situation. The psychological and social factors in patients play an important role in the pathogenesis of the belching. Next PQR is 3, impotence with mental depression, relaxed penis with sexual desire and excitement. PQR 4, no erection even after caresses, no emission, no orgasm during an embrace. We have two remedies listed here, caladium and selenium. Research studies show that people with depression have problem with their sex life. One study even found that 82% of men with erectile dysfunction have depression as in the background. Erectile dysfunction can be defined as the persistent or recurrent inability to achieve and maintain a penile erection of sufficient rigidity to permit satisfactory sexual activity for at least 3 months. Clinically, the client below 40 years of age, here we can attribute the cause being stress, emotional causes, performance anxiety, or Dhat syndrome. Client about 40 years of age may be suffering from atherosclerosis, heart disease, hypertension, and diabetes mellitus. So he has a organic cause for erectile dysfunction that needs to be evaluated and investigated. PQR 5 tells us that pruritus vaginae induces onanism during pregnancy with mucus discharge. The vaginal itching and mucus discharge at some point of pregnancy is a normal and common occurrence. The causes include cervical secretion may increase throughout the pregnancy due to the hormonal changes. So, often the cervix and vaginal walls, but it can irritate the skin of the vulva, causing itching. During pregnancy, low progesterone may cause dryness in some pregnant females and can cause itching. During pregnancy, vagina becomes engorged with blood and it may feel stretched and becomes more sensitive than normal. Cholestasis of pregnancy may occur late in pregnancy, cause extreme itchiness, affect the entire body including the vaginal area. There can be concurrent candida infection needs to be investigated as the hormonal changes during pregnancy disrupt the pH balance of vagina causing candidiasis, vaginal candidiasis. As it multiplies in that environment, the sign and symptom include burning, thick cotton cheese vaginal discharge. Trichomonal infection, if it is there, produces a frothy yellow-green vaginal discharge and cause vulvovaginal soreness. Let us see the PQR 6 falls asleep during evening fever and awakes when it stops. So, this symptom is an important concomitant symptom suggestive of this remedy during fever. However, from the diagnostic point of view, the exact cause of the fever needs further investigation. PQR 7 sweet sweat attracts the flies. The gnats and the flies are naturally attracted to fruity and sweet scents. Hygiene products, soap, perfume, lotion or hairspray and laundry detergent may contain flowery or fruity smells. Body heat and moisture also plays a role. Therefore, perspiration and mucus around the eyes and nose can also attract the flies. Many studies have investigated that could attract the insects of medical importance, and a crucial role has lately been attributed to the human skin odors. Mosquitoes appear to prefer certain victims over others, and these include men, pregnant female, obese people, people with blood group O, people sweating higher amounts of uric acid, lactic acid and ammonia, people who have recently drunk beer. PQR 8 mosquito and insect bites burn and itch intensely. The high risk of severe allergic reaction, younger children's allergies to be the component of mosquito saliva, such as proteins and antimicrobial agents. Symptoms of mosquito more severe allergic reaction include large area of itching and urticaria around the site of bite, bruises near the site of bite and local lymphangitis. PQR 9 tells us aversion to motion, dreads to move. Similar is bryonia. And PQR 10 is destroyed the craving for tobacco. Dread to move, in reference to tobacco heart, represents high risk features of smoking including coronary artery disease, peripheral vascular disease, chronic obstructive pulmonary disease and pneumonia. This stage is having a marked cardiopulmonary decompensatory phase marked with severe breathlessness and angina of effort. He cannot dare move. The caladium helps in quitting smoking by destroying the urge to smoke. Thank you very much, friends, for your patient listening.